welcome to the Nephro podcast brought to you by RPG Life Sciences, and thank you very much for joining with us.
Thank
We
you.
are delighted to host Dr. Siddhesh Dhaygude. Is a renowned nephrologist and renal specialist with over 25 years of experience in diagnosing and managing complex kidney-related disorders, and he currently practices at Dr. Dhaygude's clinic in Nigdi Pradhikaran and Pimpri Chinchwad as well. Thank you so much, sir, joining with us.
Thank you, ma'am.
Let's start. We'll have discussion today. We'll have discussion on kidney transplant.
Yes.
So, sir, my first question is, what does kidney transplant actually mean for a patient's life?
Yes. See, kidney transplant is done in a patient where their original kidneys or native kidneys are not functioning well, and they need a support of a dialysis for their sustaining their life. So it's very a life-saving therapy, I would say, in maintaining their life, as well as they can go for day-to-day wages and run their family. So it's a second life, I would call, for those patients who are having permanent kidney problem or chronic kidney disease with end-stage kidney disease.
Okay, sir, that's why I'm about to ask, like, who really need transplant and when?
See, basically, kidney transplant is done in those patients whose original kidneys are not functioning and they require life support system like dialysis to maintain their life. This is done when the kidney function is not able to maintain their body's day-to-day need, and it is not able to clear the metabolic waste products from the body, and they require external assistance for that. And
Okay.
in those patients, we do kidney transplantation as a treatment.
Okay. So now, like, what makes someone a good candidate for a transplant?
Okay. First and foremost thing that we have to know is the patient who is doing regular 3 times a week dialysis is maintaining his health very well. Those patients who do twice a week or once in a week, or they miss frequently their sessions, they do not maintain their physique or health, and that is why the risk of kidney transplant also increases. Anesthesia risk also increases. Overall outcome of the transplant is also guarded in those patients. So first and foremost thing, I would say that they should do their dialysis very regularly. They should follow up with their nephrologist very regularly, and they should be monitored very regularly in terms of hemoglobin, other protein, calcium, phosphorus balance, and parathormone level, etc.
Okay. So, sir, what test and evaluation our patient should expect before transplant?
Okay. So basically, before doing or undergoing kidney transplant surgery, the patient undergoes a battery of investigations. In that, we have a routine investigations like hemogram, urine routine, liver function test, kidney function test, calcium, phosphorus. For most important thing we do is a cardiac workup, because commonest cause of life-threatening issue in a kidney patient is heart risk,
Okay.
heart attack, or some heart event, arrhythmias, acute myocardial infarction. These are the events. So the patient undergoes probably a stress test, 2D echo, and in those patients, wherever indicated, we do coronary angiography also. We tackle the heart problem before they go for a transplantation, and then we take, once the patient is fit for surgery, then we go for it. And apart from those, other comorbidities also need to be addressed. Apart in that, if patient is having bronchial asthma, we evaluate for the same. If the patient is having some neurological issues, we address before we go for the transplant. So it is individualized in different cases.
Sir, what are the different types of donor kidney?
There are 2 types of mainly donations that has been done in India. First is deceased donor, that is brain death patient who donates the kidney to the wait listed patients. And second is live related kidney transplantation. The near and dear one from the family donates to the patient. So these are the 2 main types of the kidney transplantation that have been practiced mainly in India, and they are illegal.
Okay. So, sir, in relation, who will able to donate the kidney, and how safe it is for someone to donate a kidney?
In live related kidney transplantation in India, law has defined who can donate the kidney. So basically, if we consider the Human Organ Transplantation Act, the immediate relatives of the patient can donate the kidney, like mother, father, wife, children whose age is more than 18 years, or grandmother, grandfather from maternal or paternal side both. Apart from these, the other relatives are unrelated, terms as unrelated, maybe aunt, maybe uncle. Those are terms unrelated, and we need to take a special permissions for them. Totally unrelated or altruistic transplantation is not allowed in India.
Okay. Sir, what can patient do while waiting stay healthy and transplant ready?
For once the patient is waiting for a kidney transplantation while on dialysis, as I said, we have to, my patient has to follow few things. First, he should not miss the sessions. He should be regular in doing his dialysis, and the adequacy of the dialysis should be monitored very well. Because many of the times patient try to cut, or the circumstances are such like they do 3 hours dialysis, 2.5 hours dialysis, maybe twice a week or 3 times a week, but that does not give adequate dialysis. So adequate dialysis is important, not missing the sessions. He or she should be very regular with the medications that the patient is taking as advised by their doctor. And fourth is mental health also. They should keep their mental health very well, because many of these patients get depressed, and that is why they lose their interest in the life. So if they need, they can go for a counseling, they can see a psychiatrist, and if required, we can treat them with the medications as well.
So, sir, you have very well explained about the transplant type of donors. So now, sir, how does the actual transplant or surgery works, and what is the recovery time in the first few weeks?
Okay. Many of the times, the transplant surgery for a donor is done laparoscopically. We dissect the kidney by laparoscopy. We take a small incision in the abdomen, and we take out the kidney from that small incision, which is around 4 centimeter or 5 centimeter, I would say, from which the kidney is removed. In open surgery, there is a very large incision, which is not practiced nowadays unless medical conditions force the doctor to do the same. But most of the times it is done by laparoscopy. Recipient surgery is usually done by open, and sometimes both the surgeries can be done with robo-assisted devices. Recipient surgery is done with open, and usually the recovery time for the donor is around 3 to 5 days in the hospital, and for the recipient around 7 to 10 days. After 15 days, donor can go back to his or her work. Recipient usually is say 3 months, up to 3 months, his immunosuppression levels are on the higher side. So he has to be in the restricted environment, not isolated, I would say, but restricted or not in contact with many people, and to avoid the infection. After 3 months, if everything is okay, he or she also can go back to their work.
So, sir, what lifestyle changes patient expect after recovery, and how the family or caregiver support to that patient?
Yes. So for donor, there are no restrictions. First thing.
Okay.
Second thing, for a recipient, clean, healthy environment is expected. It's not that we need to isolate totally the patient so as to avoid contact with anyone. So clean and neat environment is expected. The patient should avoid contact with the person who is having some disease, so he or she should not acquire the same infection. Clean boiled water drinking to avoid the infection. Daily cooked fresh food is the expectation, and clean healthy room. That's it. These are the only things that we have to follow. The patient should wash their hands. They should keep themselves very clean, and use the mask when they go with the in the contact with the people.
Sir, is there any time duration for all this?
Basically, these things are supposed to be practiced lifelong, but because there are bare minimum things that we expect. Wash the hands before eating the food or when you go to the toilet. Second thing, keep your body clean, change the clothes regularly, eat healthy food and drink healthy water. That's it. There are no extraordinary precautions that are needed, and avoid crowded closed spaces. That is most important. Like cinema home, cinema theater, or you can say any program where the too many people are sitting in one closed room, where the chances of acquiring infection can be high. If it is unavoidable, then in such environments one should use mask.
Okay. So, sir, last, what is the big myth about the kidney transplant?
Big myth. Okay. First thing, myth is one thing I have observed in the patients is once they get transplanted, it will be lifelong. It's not that way.
Okay.
See, once we implant or transplant the kidney in the patient's body, it's not his or her own kidney. So your immunity is going to attack that kidney. To maintain that kidney in a functional status, we have to give them the drugs.
Okay.
So once we do the kidney transplantation, say 100 kidney transplant we done today, out of them 98 to 99% transplant get successful. 1 or 2% may fail on table or because of unexplained reasons. And after that, depending on the immunity and also what is the age of the donor, what are there any comorbidities to the donor, are there any comorbidities to the patient, how patient takes regular medication, does she get any infection. Depending on that, the life of new kidney will also be decided in the body. So that we have to understand. Nowadays we do both matching group as well as ABO across mismatched transplants also. But these things we have to understand very clearly that there is a life to the new kidney, and that we cannot ascertain before we do the transplantation. After we do the transplant, we can say and we can try to increase the life of that kidney. If the transplant fails, she or patient can go back to the dialysis, or we can consider second transplantation in such situation.
Thank you, sir, for such a wonderful explanation and your practical insights about the kidney transplant.
Thank you.
This information definitely helps to the patients and family members and caregivers. So, last one concluding remark on this topic.
Kidney transplant is not a difficult thing that patient needs to think about. It's very routinely done surgery today. It improves the patient's life to a great extent. It makes the patient independent and working, and patient can live a happy life.
Okay. Thank you, sir. Thank you very much.
Thank you, ma'am.
Thank you.